everyone.
Okay, so what we're going to do is share our screen, and I'm going to present the first few slides and then turn it over to Calyn so she can present the additional. When I share the screen, if something happens to me, if you guys cannot hear me, just please interrupt and say something because I won't be able to see everyone whenever I share the screen. All right, so I'm hoping everyone can hear us. Okay, so the truth about opioid addiction.
We can hear you and see your screen.
Okay, awesome. So our slideshow is titled The Truth About Opioid Addiction and Recovery. We are going to present just about a 45 minute slideshow on what we know and what we've seen and what we work with related to opioid addiction. Kind of briefly talk about what it is, talk about some statistics, the signs you might want to look for, and if you or anybody else that you know have suffer from opioid addiction, how to get help and where to get it help from. So we'll start by looking at the definition. What are opioids? So opioids are natural or they're man-made, also known as synthetic substances that typically bind to the same opioid receptors in the brain. That controls pain, the pleasure principle of the brain, and also addictive behavior. Okay. So just for some current statistics, since 2000, opioid-related overdose deaths among 15 to 24-year-olds, it has increased by as much as 30.7% yearly. Overdose deaths due to opioids have increased 500% with this age group since 1999. So high school students who are prescribed opioids are said to be 33% more likely to misuse opioids after high school. So that's just like kids that are being prescribed opioids for any procedure, surgeries, anything related to pain. We see that a lot. And even dental procedures, we see a lot too. They get prescribed pain pills, and then all of a sudden, next thing you know, they have an issue. 5.3% of 12th graders have abused opioids other than heroin at least once. And we'll talk about different types of opioids too in just a few minutes. And then 0.4% have abused heroin. And that's actually a pretty high number, honestly. On the next slide, we're going to look at some closer to home statistics here in our own hometown. I wanted to mention quickly just that like between 1999 and 2019, there were 500,000 opioid related overdoses. And that's almost like 3 times the population of Shreveport. As I think we have like over 192,000 people here. And so in those 20 years, 500,000 opioid related overdoses have occurred. And that's outrageous. That's very high. So for the age group of 12 to 17, 23,000, which is 6.35%, report using drugs within the last month. Among them, 78.26% report using marijuana within the last month. Up to 0.14% used heroin within the last month. Although the data is limited, we do know that. And then 2.49% report misusing pain relievers, kind of like what we were just talking about. Oops, excuse me. So for the age group of 18 to 25, 129,000 report using drugs within the last month. And for Louisiana groups, this group are 22.27 less likely to use drugs than the average American in the same age group. And that was compared, it was taken from the National Center for Drug Abuse, and it was also compared to all the other states. Okay. So I'm sure everyone's heard of these drugs. So heroin, codeine, morphine, methadone, fentanyl, oxycodone, hydrocodone, and Percocets. There's some street names to some of them. I'm sure I thought this would be a little bit more interactive, and we were going to ask you guys, have y'all heard of it? But since we can't see or hear you, then we'll just assume that everyone here is familiar or at least has heard of, a few of these. So these are all classified as opiates. Okay. So these people, what if these people were still alive? So all these people are a mixture of actors, actresses, singers. Y'all have probably heard of a lot of these actors. John Belushi, he's from Saturday Night Live and also the Blues Brothers. Chris Farley, he was a Tommy Boy, Saturday Night Live also, and a lot of other really popular movies too. Philip Seymour Hoffman, he was an actor, and he was also in the Hunger Games. And then Amy Winehouse, she was not, well, it doesn't seem like that long ago. It's been a while, but she was a singer songwriter. She was very young, and actually had a song about rehab and drugs and stuff. And so she died from all these people died of some type of opioid overdose. And then Kurt Cobain, Jim Morrison, these are all different. These are singers. I know you guys have probably heard about them as well. So we want to look and see, since there's so many opiates to talk about, we wanted to narrow it down just a little and just talk specifically about one, which is something that's major to us, is heroin. Because we're seeing so much of this in our population with teens, especially, but even adults too. It seems to be really becoming a huge issue here in our own hometown. So we want to kind of look at this and see what it is, how it's made, where, just a little of the history from it. So heroin comes from poppies. Harvesters cut the pod and juice seeps out, which you see right there on the right. The sap has a high content of morphine, and that's what creates the heroin. Me and Calyn and I were talking before this presentation, and I wasn't going to mention this with there being teenagers in here, but she was mentioning, like, on the Wizard of Oz. I don't know how many of you guys have seen that, but there's poppy fields that they walk through, and that puts them to sleep. So they're really pretty flowers, and this is what they look like. I think it kind of ruined it for me for Wizard of Oz. So yeah, that's what happens is they cut these pods that you see here right down the side, and what you see, this white milky substance, it has a high content of morphine, and that's what they use to make heroin. So very, very interesting. And then we touch on how is heroin used. It can be smoked, injected, snorted, um, all the above. Addiction can occur and will occur with any of the methods. Most people start out usually as maybe sniffing it and then end up injecting it, is what normally happens. And so why do people use heroin? They need another high after running out of prescription painkillers like Vicodin or Oxycontin. It feels good, but it's like any other drug that is highly addictive. It's only the first time that you get the high that you experience, and the rest of the time you're just kind of chasing that. It's continued use to stop withdrawal effects. A lot of people, when they use heroin, the withdrawal symptoms are so painful and bad to go through that they can't get through the sickness and feeling sick that they have to use, so that they just don't feel sick. It's, and it's really bad. And then genetically vulnerable, it's addiction in the family, which we know now that, familial history is a huge key into substance use with any drug, but it is hereditary and it is genetic, and kids that have parents that use alcohol or any type of substances are 85 times more likely to use. So the use of other drugs can lead to it. That's why we do kind of talk about a lot about where we work at, that everyone kind of starts on marijuana or alcohol, and it kind of leads to, you know, bigger and better things, in their words. And then heroin is cheaper than cigarettes and prescription opioids. That's why a lot of people turn to heroin, is because opioids like oxycodone, oxycontin, prescription painkillers, once your prescription runs out, a lot of people turn to people on the street to start buying them, and they can be really costly, like $25 a pill, or even more. It just depends. Probably, you know, when you're buying them on the street, people, they're out to make money, and they don't care, and they'll charge you whatever, but it's very costly, and people cannot afford that for very long. And so heroin, you can buy it as little as like $10, a pouch of $10 worth. And that's how it can just be, you know, inexpensive, but turn into be very expensive in the long run, you know, in many ways, and more than one. So how do opioids hurt your body? We're going to look at and see how it affects the brain. And Calyn is going to talk about, this is kind of her forte. She's going to talk about how drugs affect our brain, and talk a little bit about things that happen whenever we use it. So Calyn, you can go ahead and turn it on over to you.
Okay. Oh, well, hey everyone. My name's Calyn. So we're going to talk about how do opioids affect the brain and the body. Like, what does it do? How does it make you feel? That kind of thing. That's why they say addiction is a brain disease, because what it does, it really does affect our brain in different ways. So what you see on your screen is you see a diagram of the brain. If I were able to turn to the right, this would be you would see somebody from the right side. And these are just different parts of the brain that do different things, like your frontal lobe is like your judgment, your temporal lobe, which is in the green, has anything to do with your hearing, and then all the other things. An occipital lobe, you see is in pink. And so basically each part of your brain has a different effect, and how do you do with your body. So we're going to the next one. So this is what we call somatic pruning. So there are a lot, we know that there are neurons in our brain that takes less than a millisecond, that we don't tell our arm to move, right? We don't tell our fingers to move. It just instantly happens. And that's because we have all these connections that go from like maybe the tip of our finger all the way up to our brain. And a message goes from our brain to the tip of our finger that says, hey, move your finger. And it's really, really quick. And what you see on your screen is a picture of these synapses, these neurons, and what they look like. So like at birth, you see there's not a lot of them. And then once we get around 6 years old or so, the connections start to get a little bit better. And that's why they say like elementary school, and like one of the things they tell you, the best time to learn a second language is like elementary school, because you're able to remember it more than you already get older. And then about 14 years old, you see that it starts to they start to just kind of not be so close together anymore. And that's because once we reach that age, our brain starts to weed out the things that we don't really use as much anymore. Start using the skills we don't use as much anymore. The things that we don't, do anymore. So like in a healthy brain, synapses are used over and over, grow stronger, and synapses that aren't used much get weaker. Like playing a piano, piano lessons, if you keep doing that at a young age, keep doing it, that skill is going to get stronger and stronger. But over time, if you don't use that skill anymore, your brain starts to just not be good at that skill anymore. This refinement relies on delicate balance of interactions between neurons. Alcohol and drugs act directly on brain chemistry and disrupt the balance. So we see this a lot with the teens that we work with, or you'll see with people that are in addiction with adults, they'll start acting, they stop aging. at the point that they start using. And that's because of those neurons. It just stops growing. The good news is that once you stop using, you can still develop those skills. And our brain really does not stop developing until we're 25. So what are some short-term effects of opiates? Short-term effects can be euphoria, which is just like this feel-good feeling. I'm feeling on top of the world. Drowsiness, slow breathing, constipation, severe flu symptoms, slowed and slurred speech, impaired night vision, dry mouth, unconsciousness, and weight loss. So these are just some of the things that can come with any time of opiate use. And these are sometimes like withdrawal symptoms as well, Christa mentioned earlier. And these are some of the reasons like severe flu symptoms, instead of people getting sick with those flu symptoms, they use again to quote unquote feel well. So what is addiction? It's the continued use or abuse of opioids that can result in physical dependence on addiction. The body adapts to the presence of the drug and withdrawal symptoms occur if use is reduced or stopped. Tolerance can also occur, meaning that long-term users must increase their dose to achieve the same high. So kind of like I mentioned earlier, addiction is like whenever they start with opiates with the withdrawal symptoms, those severe flu symptoms, the vomiting, the shaking, the diarrhea, things like that. They, in order to use people with opioids, they quote unquote, like I said, to get to feel well again. There is no euphoria anymore. It's just to make them, it's to make them feel better. Um, and then like the tolerance is whenever you use this, like you might start off with a little bit to get that euphoria, that feel good effect, and then that doesn't do it anymore. And so you have to take a little bit more to get that same effect. And it just increases from there. So what are some long-term physical consequences to opiates? It can lead to death, which we've heard of, a lot of opiate overdoses, permanent damage to the lungs, liver, kidney, and brain. So with your increase for lung disease, liver disease, kidney disease, and of course, it affects those brains, permanent damage. It can suppress your immune system. It can create bad teeth. Your gums kind of get inflamed or swollen. You can put you in a coma. Muscle weakness, which then can lead to partial paralysis. Again, that's part of those neurons being affected. Then also can create heart problems, heart infections, blood infections, skin infections, HIV, AIDS. That's IV users. So whenever people use IV, you'll see here in a little bit the needle marks and things like that. That's where that comes from. And then also again, loss of memory and intellectual performance. So how can you tell if your friend or someone that you love is using? So most times that we look for is like a major change in attitude or behavior. Moody, going from angry to they might be calm one minute and then instantly they become really angry. You just see a lot of mood swings. Needle marks on arms and legs for anyone with IV use, like you see on the top right. You see those needle marks, or we call them track marks. Then for the eyes, you can see constricted pinpoint pupils, which you'll see on the bottom, the left one. It's just like really dot where your pupils are in the eyes. And then also they have trouble staying awake or falling asleep at inappropriate times. So like, especially with kids, if they are sleeping during the day at school, they're just not, or and somebody sleeping at work, just a lot of that kind of stuff. And then flushed, itchy skin, that's another thing you can look for. And then not attending activities once enjoyed, MIA. So if you notice your friend or your loved one is not there anymore, not in family activities, not used to just kind of blowing you off a lot, or just not doing what they used to enjoy a lot. Those are some of the things we look for. So how do you know somebody's going into an opiate overdose? These are things you can look for when you notice signs of an overdose. They begin to be slow, weak, or there's no breathing. They have a choking or gurgling or snoring sounds. You'll see the lips or the fingernails are blue lips and fingernails. Their clammy skin feels cold. They're shaking. They're dizzy and confused. So they're like they're disoriented. They don't know where they are. They don't know what day it is, or they can't be woken up. You try to shake them up. You try to do whatever you can to wake them up, and they just can't wake up. So what do you do whenever you see that? So whenever you do that, I apologize. There's a dog in the house. So what should you do immediately when you notice these signs? The blue lips, the fingernails, the clammy skin. You can't get them to respond. Immediately call 911. That's what the first thing you need to do. On here we have Narcan, which is naloxone. That's something that that we have on handy at work. If you know, like health officials, they have these, or the EMTs that you call will have Narcan. And what it is basically adrenaline. Is they just put this in their nose, and then they spray it. But if you don't have that, that's okay. Just call 911 immediately, and then also stay with the person until help arrives. So how do we treat opiate addiction? So there are many factors for how to treat opiate addiction. It depends on how long they've been using. It depends on how often they've been using and how much they've been using. And then whether any other drugs are involved. With the opiate use, a lot of times with opiate use, they might use alcohol with it. They might use antidepressant sedatives. They might use, smoke marijuana. So just, it depends on a lot of those factors. So here's treatment and recovery. Once you try to get somebody into treatment and recovery, this is what this process looks like. And this is what me and Christa do with our job. So like I said, it depends on the type, how the frequency is, the length of use, those things get addressed first. And then we determine what type of treatment that person gets. We do there's medical detox. Like I said, with those withdrawal symptoms, those severe blues, those flu symptoms, the headaches, the throwing up, those people that really use, they need to be monitored 24/7 for a while until they can get pretty stable. That requires a nurse. So that's what detox is. Then there is medication assisted treatment. Some of y'all have probably heard of Suboxone and naltrexone. Yeah, that are just that help with opiate treatment. And then there's also a residential program, which is what me and Christa do. We do the 28-day program, which that's where they live at our facility for 28 days. They have and do therapy 5 days, at least minimum 5 days a week. They don't go anywhere except for recreational activities, and it's more intensive. Then there's intensive outpatient, which is 90 days, which they do therapy a couple of hours, a couple of days a week, and then go back to wherever they live and then come back. They're able to leave where the treatment is. And then outpatient counseling, which is maybe once a week, and they do therapy once a week. And then there's also some people do 12-step programs or support groups. If you've heard of AA, Alcoholics Anonymous, which has been around for over 100 years or so. And then you have NA, which is Narcotics Anonymous. Those are 12. Those are more support groups. Those are more community-based. They're led by each other, like people in recovery, as more than a regular professional like me or Christa, like a therapist.
I wanted to throw in and mention here on the slide is that even though all these treatments could stand alone, quite honestly, serious opioid addiction, people with those type of addictions that are strong like that, you typically start off with the detox, then they incorporate the medication to help wean them off for a few days while they're in detox. Then they participate in the residential treatment program for at least 28 days, and some go as long as 90 days. And then they step down to outpatient, the intensive outpatient, which they do a few times a week, like Calyn was saying. And then they step even farther down to regular outpatient counseling. And at the same time, in a support recovery group like the AANA, like Calyn was talking about. This is kind of like the path that they go on because it's so intense of an addiction that it takes quite a bit of time to actually detox the body, get the treatment and everything else. So it's a lengthy process because of the severity of the addiction. So I just wanted to throw that in there because I saw how it was kind of building on each other.
All right. So recovery. So what does recovery look like for people with opiate addiction or just any addiction in general? So like Christa touched on, so stop using the drug is one part of the process. So whenever people with any type of addiction, especially opiates, it affects many aspects of a person's life. It affects their family, their health, their work or school, personal relationships, finances. They have all these different aspects of their life, like how with someone with opiates, it might be family, it might be there's a lot of mistrust within the family. There could have been a lot of lying, a lot of stealing, like you saw with the short-term and long-term effects, the health, the detox. Work, school, they might not have a job, or they've dropped out of school, personal relationships again with trust and finances, they have they're not at work. So part of recovery and part of that step-by-step process, and we do with treatment, is to help them address those different aspects of their life to get them back on their feet. And then that's why we say recovery is a day-by-day process, because like things aren't fixed in an instant. We just tell them you got to take it day by day. So these are just some local resources that we have here in Shreveport. Me and Christa, like I said, we work at the Council on Alcoholism and Drug Abuse, where we have adults for the residential program, IOP, outpatient, and the adolescent residential and outpatient. And this is just one of our numbers. And there's also the Center for Behavioral Health, which is the adults, and then Active Recovery, which is for And then also here's some additional websites and videos that you can watch on opiates. Some of these we use with our own kids that we work with. There's called Chasing the Dragon, Life an Opiate Addict. This was put together by the FBI and DEA. It's on, actually, you can just Google it on YouTube. It's about a 15-minute video that shows real life people and how opiates have affected them in their lives. You can just, put it on, search it on YouTube and find it. I will warn you, it is a little intense. It's very real and very raw, I should say. So that's just something you might want to watch. And they call it Chasing the Dragon because we say Chasing the Dragon because it's like trying to find that chase the first high. Then they had the Foundation for a Drug-Free World. These are just some short little documentaries on opiates, and then also on other drugs as well. Any other drug that you have questions about, that's a good one. And then we have the National Institute on Drug Abuse for Teens, or it's just the National Institute on Drug Abuse. These are just some resources if you want to speak with teens about. They have good facts, up-to-date facts, little worksheets and things like that. And then there's also the Mouse Party Game, which is learn how different drugs affect the body. If you want to learn more about what specific drugs, how they specifically affect the brain, this is a cute little interactive way to do it. And then also there's the Substance Abuse and Mental Health Service Administration. And this is an organization that has also current statistics, and they also have a helpline as well that if you want to receive help.
Yep. So at this time, what we normally like to do is to get more of interactive audience to be able to reach out to answer any type of questions that someone may have, to help clear up any misconceptions or myths, or just anybody to be able to just share anything that they would like to at this time. We hope that that presentation was informative for you guys. Like I said, that's just touching on just heroin. A lot of things go into it, but it's very serious. And we find that these kids are getting younger and younger. We service the population from of 12 to 17-year-olds. Thank you. 12 to 17-year-olds. And like Calyn was explaining, they stay with us for 28 days. But to be completely honest with you, regardless of what drugs that they're using, the ones that are using the harder drugs like heroin or meth, alcohol, even 28 days is just not enough time. And yeah, so it's what we're trying to do is just plant seeds here and to try to change ways of thinkings with our adolescents. It works, and so that as they become or go into adulthood, that they have a better or an easier way of thinking and understanding what's to come. Which most everyone starts as a teenager with drug use. Not everyone, but most of the population does. So we wanted to give everyone an opportunity to ask anything that they would like to ask, or just to comment on what you either thought about the presentation, if you know somebody that, or it's really up close and personal to both Calyn and myself, because we see it pretty much on a daily basis. And we also have both know people who have suffered with overdoses. Yes. Okay. So she's Mandy's saying that she's giving everyone ability to unmute yourself. So if you wanted to unmute or ask us in a chat, please feel free to do so at this time.
Hey guys, this is Melissa Stainback. Can you hear me?
Yes.
Okay, great. I have a question. That was a great presentation. Thank you. I enjoyed it, and I always really love to get the perspective of like people who are actually working with adolescents that are in treatment. And what I was thinking about was on the prevention front, based on your experience working with adolescents, what can we do on the prevention front to sort of steer people off of this, path? Do you have any thoughts on that?
I'll put my 2 cents in, and I'll let Calyn kind of put her 2 cents in. What we have kind of found, I mean, educating them and getting it out, you'd be surprised, is just getting the word out to them, explaining what it is, what to be on the lookout for. It's a lot of it's an environmental thing, but it's just, to me, it's putting the knowledge out there to them and getting them educated on how things are working, what's out there, and just that and other. That's the main thing to me. Calyn, what are you thinking in terms of prevention?
Yeah, I'll say, yeah, education, most definitely. And I say education on what actually the drugs do to your body and your brain. Because um because what it does is, I've known a lot of these fear tactics. They show you in school, this is what you're gonna look like. This is before and this is after. They show that fear factor, and that doesn't work. It's shown even with the DARE program. The statistics on prevention, believe it or not, are very, very low. So things like that. So, but education more on like what it does to your body and to your brain. To answer your question specifically, is the best prevention to start? That's a good question.
Yeah, I would really think that it would be around 14 years old, because even though we accept, we do take adolescents 12 to 17, and we have had some 12-year-olds in the 5 years that I've been there, but not many. We've had a
Mhm.
couple, and I would say that our average, the median age would probably be the 13 to 14, and that's usually they have not been using for that long. But it's environmental, parental guidance, all plays roles, factors, their support systems at home, and just keeping, whenever it comes to kids, I feel like keeping them busy with productive things that are positive, engaging things with family and friends that they're able to do would keep them from getting wrong crowds, wrong place, wrong time, things like that. Because unfortunately, what we see a lot, it is everywhere, guys. It's everywhere in all schools, all walks of
Mhm.
life. It does not discriminate. It's everywhere. And I have a 19 and a 20-year-old. So they've graduated high school a couple years ago. But when they were in high school, they would tell me, "Oh, mom, this guy was trying to sell cocaine." And it's flooring as a parent to hear your kids say that. And you're like, well, of course, you're like, what did you do? And they're like, well, of course I didn't do it. And I'm like, yeah, I know, but but just to know that, and we live in kind of like a country out of the outskirts of Shreveport. And so my kids went to a smaller high school. So I know that if it's that prevalent there in a small high school, then I can just imagine like the bigger high schools that I went to, that Calyn went to. It's just gotten really out of hand over the years. And what's so alarming is the age factor, that these are children of, our future. It's just younger and younger. They're so involved in it. And they really know more than what we really give them credit for knowing. They really do. And so I just really feel that if the younger, the better, where it's not traumatizing. So I would really say around that age, Melissa, to answer your question directly. Good question, though.
Okay, yeah, that's great information. I appreciate that. And kind of shifting gears, one more question, and then I'll turn the floor over, I promise.
No, you're fine.
Okay, I love that answer on the prevention front, and that's kind of what we're trying to work on too in our region is how do we approach that. Now, the other thing I want to ask you about, it's not related to adolescents, it's more related to adults. So I don't know if you'll be able to speak to this or not, but what I've run into is when you have adults who do not want to go to treatment, do you have any advice on how to make that link to service or to treatment, or convincing, or anything on that front?
Yeah, that's so tough. That's so tough because like I know with kids, with them being minors, their parents can make them, or the law, a lot of times can step in and do it. But just for somebody on a volunteer basis, I worked with the adults for about 10 months at CADA, but it's been a long time ago. And then personally speaking, a lot of us who do work are in recovery as well. And I can tell you personally that unfortunately, you could offer all the resources and put everything out there and the support and every aspect to help and the avenues but until that person really gets ready and really tired of living the way that they're doing, it could be a traumatic event that would make that happen, or they just a cycle of the vicious cycle of day-to-day misery that comes with being addicted. Sooner or later that's going to end, and have them reach out. So I think just making it known that, hey, you have people that care and support and love you, that want you to get help, that what you're dealing with and messing with, potentially could end your life, and we don't want to know what it's like to be without you. We need you to be here. Just knowing sometimes that they have somebody there, I think is huge, really important. And then also just to make sure that they have the resources to reach out to get help, or even to call some person to say, okay, I'm ready. And then, we have peer support that we have with our company. And so 24-hour hotlines, this, that, and other, and there's all kinds of them. I think just them knowing, but it's really sad. Addiction is just it's just a horrible thing to get caught up in. But there are ways out, but it's just so individualized and so dependent on that person just being sick and tired of being sick and tired. That's really the honest truth. Did you have anything that you want to add to that, Calyn?
Yeah, and for people who are helping people with addiction, you got to make sure that you can care so much and love them so much, but you can't love them to death, is what we say. And you got to make sure that you're putting healthy boundaries in place and make sure you're not enabling them and continue that behavior. Sometimes, those boundaries, those quick boundaries, I'm not going to drive you these places. I'm not going to help you with your addiction. You got to make sure you do that as well for people that you just, that you want to get help. But like Christa said, they got to want to get help.
All right, thank you so much, Christa and Calyn, for your presentation. We still have time for more questions. If anybody has any, you can type them up in the chat, or you can unmute yourself. In the meantime, I do want to remind everybody that we do have both physical materials and digital resources on the subject at the library. And so you can visit us at any of our 7 locations here in Bossier Parish and at our website at bossierlibrary.org. So I don't see any more questions on the chat. I don't think anybody else has any other questions. So once again, I just want to thank Christa and Calyn. That was very informative. I just want to remind everybody that there will be recording of this session on our website at bossierlibrary.org/community-conversations. And we hope to see you all next week at our next session.
Thank you guys for having us, and we
Yeah.
look forward to helping serve you guys or serving the community anytime you guys need. Thank you. We see a
Thank
couple
you.
familiar names. So, hey, everyone. I don't want to call you out, but hey, nice to see you guys.
Mhm.
So
Thank you.
thank you. Thank you.
Thanks.
Mhm.
Thank you.
Thank you.